I'm going to talk to you about something totally different, but it has been alluded to already by Lieven and also by Marie. All of you know so much more about Spina Bifida and Hydrocephalus and what it does and so on than I do. I'm very grateful to you all for sharing your experiences, and also I'm very grateful that you invited me to come and talk to you about prevention. I have in my slides to acknowledge the work of many of my colleagues in IF and also in the Food Fortification Initiative. Oops, why doesn't I'm trying to go to the next slide, but it doesn't want me to. Okay, next slide.
Anna, if you click on the actual slides and then press your down arrow, I had some problems as well.
Yeah, there we are, sorry. Okay, now NTDs, I'm using NTDs and Spina Bifida a bit interchangeably. We have, as Lieven said already, not very good data. There was an estimation in 2015 that there are about 260,000 NTD-affected birth outcomes worldwide, of about half. In about half of the cases, these are elective terminations. And also there are a lot of under 5 deaths. The systematic review, which is quoted here below, showed that there's really a lack of high quality data from regions of the world where the highest burden occurs. And this is a real problem. We talked about prevention earlier, and really until 27 years ago, we did not know that we could prevent quite a lot of the neural tube defects that occur. We know and we knew that all people need folic acid, vitamin B12 for healthy cells and to prevent folate deficiency anemia. But it was only in 1991 that the study published in the United Kingdom showed that 400 microgram of folic acid taken daily from 8 weeks or 2 months before conception till 12 weeks into the pregnancy can help reduce the risk of spina bifida and anencephaly by up to 70%. Not all spina bifida and hydrocephaly can be prevented. That's important also to realize. And after that study, which had to be stopped because the results were so incredible, we now know that we can help prevent many of these birth defects. Now, all over the world, pregnant women are given already iron and folic acid tablets in pregnancy, and that is mostly in the last 3 months. But that is too late for preventing spina bifida and anencephaly. And I've put a reference to the study. In Dutch, we don't make a difference between food folate and folic acid, but in English you do. And food folate, you can find it in liver, you can find it in dark green vegetables, you can find it in lentils, beans, oranges, tomatoes. It's a water-soluble vitamin, and it is about half of what you eat is available for the body to work with. Folic acid, on the other hand, is the form that is found in the foods, fortified foods and supplements. It's a stable compound, and it is highly bioavailable. Many people say we should eat natural foods and we should get our folic acid from the diet. Of course, you should eat the foods that contain folate, but it is almost impossible or really impossible to obtain enough folate from the natural foods to actively prevent or help prevent your child from getting a neural tube defect. To get 400 microgram of folic acid daily from natural foods, you have to eat things like 44 ripe tomatoes a day, or 4.5 cups of cooked broccoli, or 2 slices, large slices of fried beef liver every day. Of course, supplements are a good source, but also supplements do have limitations. They can be costly, and to use them every day is not easy. Many women, even when they plan a pregnancy, do not start 2 months before to take folic acid. And really the lack of health literacy and timely public health information is a problem with supplement use. There were some studies in 49, in fact, in 22 countries, which showed that really periconceptional use and correct use ranged from less than 1% in Italy, 0.5%, to 52% in the Netherlands. Really, there are many barriers, and the most important barrier is unplanned pregnancies, but also lack of awareness, misconceptions. On the other hand, we have a history, even in Europe, that is not a very fortifying continent, but even in Europe, many foods are already fortified, like, for instance, margarine, salt with iodine, and worldwide, oil is more and more fortified with vitamins A, D, and E, milk in many cases. Salt with iodine is worldwide a normal occurrence, and sugar is sometimes fortified with vitamin A. Cereals can be fortified with a multitude of vitamins and minerals. And cereals in general are a good vehicle for fortification because it's a staple food. It's the main energy source for many people who consume it daily. And they consume it in very high quantities, like in the Middle East, where I used to work, 300 grams of wheat flour a day in the form of bread was very usual. And as I said, many vitamins and minerals can be added. Also, the cereal processing industry, the flour millers and bakers, it's a very large-scale, sophisticated operation in most countries, and it is well established worldwide. We feel that flour fortification with folic acid is really a good solution, even the best solution, because it is effective, it's simple, and it's not expensive. It costs really nothing. If you compare with iron, other B vitamins, folic acid is very, very cheap to add. And also the most important one, I feel, is that it requires no change in the dietary patterns or the habits of people. Everybody who eats wheat flour or bread made with fortified wheat or maize porridge gets it. It is non-discriminating. In fact, the first country to start in the world was Oman in 1996, after they heard about this study done in the UK. And they were followed soon by the US and Canada, who all still mandate fortified flour. The impact in Oman was immediate. It's maybe not really easy to see, but after the start of the National Flour Fortification Program, the case prevalence of neural tube defects went down very rapidly and very consistently, and this is continuing to date. Is it safe? Many people ask. There have been many studies and many work done on this, but recently two authoritative bodies, convened expert panels. The US and the UK both did this, and I've quoted literally what they said, and they said, overall, the totality of the evidence examined by these panels, as well as studies published since the release of their reports, have not established risks for adverse consequences resulting from existing mandatory folic acid fortification programs that have been implemented in many countries. You will see later 81 countries. Current folic acid fortification programs have been shown to support public health in populations, and the exposure levels are informed by and adhere to the precautionary principle. The reference is here, and do by all means go and read the full article. Now, the reduction, I said already, not all neural tube defects can be prevented by fortification or by folic acid. In 8 studies from a number of countries, which was compiled some 8 years ago, it showed that there was a 31 to 78% reduced risk, and overall that's about half. There is always a base number of cases that will occur even with good fortification or full supplement use, because there are other sources as well of neural tube defects, but the other causes, but in general, reduction of half, and in some cases 3/4 is seen regularly. Currently, 81 countries in the world require folic acid in wheat flour, maize flour, and or rice. And this is from the Food Fortification Initiative database 2017, which you can also visit online at the FFI website or at the Global Food Data Exchange. And you see that the whole of the Americas, except for very few countries, fortify mandatorily. And in Africa, more and more countries, Eastern or the previous Soviet Union, the whole of the Middle East, fortify, but there's still a large number of countries where it is not the case. But where flour was fortified globally, an estimated 50,270 birth defects were prevented last year, and that's an average of 138 a day. But that is not really all that could be prevented. It's only about 13% of preventable spina bifida and anencephaly worldwide. You see here in the yellow countries, there's no prevention at all, and some of the yellow countries are already moving towards fortification. Modest prevention in some countries because either the coverage with fortified products is low or the level of folic acid added to the fortified product is low. And then there's the countries where there is really high prevention. It's very important to note that even where fortification has been introduced, it is still recommended that all women who can conceive, who can get pregnant, consume foods containing natural folate. And even where fortification has been introduced, women trying to conceive should take folic acid supplements if available, which is not the case everywhere. Fortification often delivers less than the recommended dose of 400 microgram because of concerns about safety, which are maybe ill-founded, but still are there. So really, if you can take the folic acid supplements, if they are available, by all means do so. And of course, women who previously had already a baby with a neural tube defect, or who have diabetes, or who take anticonvulsant therapy should be advised to take 5 milligram of folic acid daily. That is WHO recommendation of 2006. Many of you are members of spina bifida associations. You are parents with children who have spina bifida, or you are yourself living with spina bifida. What can you do to make sure that in your country also fortification takes place? First of all, it is important to understand the issue, to know if there is any NTD registration going on, what are the food and nutrition intakes, what are the foods most consumed. So the understanding of the local situation is something valuable and very important. If you can build a national fortification alliance in your country or be part of a national fortification alliance, that is a very important step, because you are the ones who can really tell others what spina bifida and what neural tube defects mean. You can also monitor the actions undertaken by government. And by all means, join the IF Global Prevention Initiative, of which here I have given the website and the Facebook page. In summary, every year in the world, 260,100 neural tube defects occur. That is an estimation, it could be more. Fortifying flour with folic acid is a safe and effective way to help prevent NTDs. Those countries that have made fortification mandatory have experienced between 31 and 78% reductions in NTD prevalence. But this depends on the level of fortification, how much folic acid is added, and also on the coverage, how much people eat of that fortified product. Globally, over 50,000 birth birth defects were prevented last year in those countries where flour was fortified with folic acid. As I said before, that is an average of 138 a day. And let's not forget, millers, flour millers, are key partners in preventing neural tube defects. Thank you for your attention. By all means, contact me if you have questions, and also for more information, go either to the website of IF or go to the website of the Food Fortification Initiative, which are both given here, and especially the website of the FFI Network Food Fortification Initiative has a lot of information on articles, countries that fortify, levels of fortification, and so on.